these studies provide you with steps you can take to improve the health of your gut, and then hopefully reap many other systemic improvements like fatigue, mental clarity, sleep. Again, because we understand how much of one's health stems back to the health of their gut. Welcome to Dr. Ruscio Radio, providing practical, science-based insights into health, exploring the importance of nutrition, lifestyle, and gut health through conversations with experts, research reviews, and personal stories. We break through the bias and the noise to bring you simple, trustworthy information that matters. Hey everyone, this is Dr. Ruscio. Welcome back. And today I'm very excited to share with you a few studies that question how helpful, how necessary are SIBO breath tests. And in a similar vein, great news that more data is being published showing that natural therapies can improve SIBO and IBS, herbal antimicrobials, and probiotics. So things that you can use safely at home with the guidance of a healthcare provider, but nonetheless put so much empowerment in your hands regarding how to improve gas, bloating, abdominal pain, altered bowel function, all these symptoms that we see associated with SIBO and IBS, but also the extraintestinal manifestations that can plague and be problematic for some people, like joint pain, skin issues, and brain fog, because we know so much stems back to the gut. And then we'll cover a few studies looking at the connection of autoimmunity and inflammation along with fungus, and lay out what you can do to improve these conditions, and also touch on one very interesting study showing the power of the elemental diet to help reduce and resolve inflammation and autoimmunity. So a lot here to unpack. Let's jump in. And the first study here I wanted to highlight examined if SIBO breath tests, so SIBO, small intestinal bacterial overgrowth, is probably implicated in about 30-ish% of IBS, so gas, bloating, diarrhea, altered bowel function, and pain. And this study, again, wanted to assess, is there a correlation between being SIBO positive and the symptoms that are sometimes associated to SIBO? And this is one of a few studies showing that no, there does not seem to be a correlation. In fact, look at what this study found specifically. Having SIBO or not having SIBO led to no difference in abdominal pain, gas and bloating, diarrhea, constipation, food intolerances, brain fog, fatigue, anxiety, and depression. Now, I've said many a time before that SIBO is a validated test, and it is. But we're seeing more research being published starting to question how essential the SIBO diagnosis is. Also, full disclosure, and I think the appropriate caveats apply, this was an observational study. So it could be skewed by selection bias or other factors that gave us a biased sampling due to the fact that it was observational in nature. But nevertheless, I felt this was an important study to put out there, because if testing isn't going to demonstrably help you better select therapies, then the testing gets in the way and it increases cost and time. So again, don't stop anything or don't change course without speaking with your doctor or your healthcare provider, but this is one data point you can discuss with them. And this is not the only one of its kind. I want to share one more here of a similar vein. Oh, and by the way, if this is helpful, please comment. I'm really enjoying the comments that you're leaving. It's helping me better understand what you're grappling with, what you'd like to hear more about. So comment, like, or subscribe. Would really appreciate it and love to hear more again about what you guys are struggling with and want to know more about. Okay, so this next study, similar, looking at does having SIBO correlate with more symptoms? And again, they found there was no correlation between SIBO and the severity of symptoms, of IBS symptoms. Again, it's an observational study, so we should be a little bit careful. But what I'm hoping these studies help you to see is now that we're looking at this more directly, it's at least coming into question the utility, the necessity of a SIBO breath test. And let's go to the author's conclusion here. We conclude that SIBO does not worsen the severity of symptoms in IBS patients. We feel that the reduction of gas levels in breath tests should not be considered a relevant clinical goal in these patients. This is contestable because there are data showing agreement between gas levels and symptoms. But one of the things I wonder about here, and we're actively researching, this is just one of many questions I'm always asking myself. You should always be questioning what you've learned, what you've been taught, what you think, is perhaps because a lot of the validation data came from Pimentel and Pimentel's group, which I feel are doing great work, but nevertheless, the findings from a center, a group, a thought leader have to be replicated by others. And that's where I think at least this question is starting to be looked at and data are being published, calling into question how necessary it is to treat the lab tests. We'll watch the data as it evolves, but again, knowing that people can spend a lot of money on these tests and have a lot of worry about them, I feel these are important data to share. And one more study here of the same type, looking at can eradication of SIBO, or does eradication of SIBO correlate with how someone's symptoms change? So you do a breath test, you have a positive test. Do you have to treat that test to negative to see an improvement in symptoms? And in this study, now we're at a clinical trial. So now we have a more rigorous setup and we have a better level of assumed accuracy of the data. And what they found is that rifaximin led to improvements in GI symptoms, whether or not there was eradication of SIBO. So everyone improved. You improved if you eradicated SIBO, you improved if you did not eradicate SIBO, and you even improved if at baseline you had no SIBO, but then you were given rifaximin. And this is probably why rifaximin, the antibiotic that is FDA approved to treat IBS, the symptoms, does not require a breath test to be used. Now, there's a different conversation here, which is academics and researchers looking at how levels of SIBO or dysbiosis change when someone's given an antibiotic. But the more important thing, at least in this realm of healthcare, in my mind, is someone's symptoms, because there is a lot going on in the GI. It's very hard to pin down one biomarker and say, this is the biomarker we have to get to that level, and then all of a sudden someone is perfectly healthy. Rather, the paradigm that we advocate for is look at the therapeutics that have good evidence and then keep personalizing those to the person's system until you hit the optimal symptomatic response. And I'm hoping that data like these are helping you to see how the paradigm is shifting in that direction. And just to maybe drive this point even further home, a conclusion from this clinical trial, the findings of our study suggest that either SIBO plays a limited role in causing IBS-associated gut microbiota disturbances, or lactose breath testing is not a good test to measure SIBO. And again, what I take away from this is perhaps we don't need to be doing routine testing of SIBO, baseline and serial repeat tests. This can get quite expensive. And in our consulting practice, we have stopped using the testing for probably about a year now, and it really does not seem to be making any difference. And sure, there's a time and a place exception, I'm sure, somewhere, and always check these things with your doctor. But knowing that testing has so much market pressure behind it, the tests are marketed to individuals who don't feel well. And when you don't feel well, as I've not felt well at moments in my life, you want to have some sort of marker to say, oh, this is the cause, this is the thing. It's so appealing. But remember, if that marker will not tell you how to get better more quickly, then that is just a distraction. I'm not claiming this is an airtight scientific case. The claim I'm making is we're starting to see more data being published, questioning, do we need baseline and serial repeat SIBO breath tests? It's a pivot I've made clinically and been very happy about, not doing the testing and really focusing on the person. How do you feel? What can we learn from how we treated you and use that to better treat you in the future? Then saying, well, let's use that lab marker. And just as one side note to reinforce this, we've discussed a impressive, I think fairly clear-cut and compelling number of studies finding that stool leaky gut testing, stool zonulin testing does not correlate with people improving their leaky gut. But for many, many, many years, I was looking at stool tests and the zonulin and saying, it's odd that this person feels better, yet they still have stool zonulin. It's one of many observations that has led me to say, well, I'm going to listen to you over the lab test. Again, this doesn't go to every realm of healthcare, but within functional GI testing, SIBO breath testing, and stool zonulin testing, it does apply. So I'm going to listen to you rather than saying, well, you feel better, but your stool zonulin is still positive for leaky gut. Therefore, you can't eat more foods. You still need all these supplements. In fact, we're going to double down harder on the food and harder on the supplements because now we see that no, there's not a correlation between stool zonulin and leaky gut. It's not a good tracking marker. So just one example of how we want to be careful not to put all of our decision-making onto the lab tests, and in the realm of functional GI, really move more toward a individual and their symptom-centric model than one of biomarker guided. I mentioned earlier that there was some good news regarding additional data being published for natural therapies for IBS and for SIBO. And that's what you're seeing here in this clinical trial of 100 SIBO patients. They were given either herbal antimicrobials or rifaximin to treat SIBO. They found a similar eradication rate using either dysbioside and FC-cytal, two natural compounds, or candibactin AR and candibactin BR. These are just multi-ingredient antimicrobials. And by the way, we are currently submitting a study wherein we used two different but similar formulas and had also documented improvements in SIBO gas levels. So we're hoping to have, I believe this will be the third, maybe the fourth study showing that herbals can remedy SIBO. But the herbals were as effective as rifaximin. But what if, coming to this point here, what if your insurance does not cover the antibiotic rifaximin? Then you're looking at $120 for the herbal protocol and $2,000 for the rifaximin. All these things can be used. And admittedly, there's more scientific research on rifaximin than there is on the herbals. But there's a growing body of evidence for the herbals, and these are going to be a lower price point. Hence why I'm excited to share one more study showcasing that there are different types of options, pharmaceutical or natural, that you can speak with your healthcare provider to improve your SIBO and, more importantly, your symptoms of gas, bloating, reflux, pain, whatever it may be. Now, one more point here, looking at rifaximin, the antibiotic, compared to probiotics. We've discussed this on the podcast in the past, but I think it's just really worth echoing again and again. What you're looking at here, and I'll narrate, obviously, two meta-analyses. One looking at the cumulative resolution rate of SIBO with probiotics. The other looking at the cumulative resolution rate for SIBO with rifaximin, the antibiotic. And you're seeing 53% for the probiotics and 59% for rifaximin. Essentially the same resolution rate for either probiotics or rifaximin. So zooming way out, what this is meant to portray is we have options. We have rifaximin, if that's what you're most comfortable with. We have probiotics, and we have herbal antimicrobials. So many options for you to improve your health. And I would submit that none of these require a breath test to use. We know that's not the case for probiotics. And we also know that's not the case for herbals. And we also know that if you really want to go super hardcore science, that rifaximin has evidence that the FDA used to approve it to treat IBS symptoms and was not necessary to have a SIBO breath test. In fact, like we showed earlier with the earlier study, you saw improvements in your symptoms with rifaximin, the antibiotic, whether you had SIBO or not. So keep in mind that if you were operating in the testing-centric paradigm and you did a SIBO breath test, your doctor may say, we can't give you rifaximin because you don't have SIBO. And what a travesty that would be, because we just showed you a study a moment ago documenting that even without SIBO, you will still see improvements from rifaximin. So again, just one of a number of growing data points showing you how much power is in your hands to quarterback your health using natural agents. Again, always do so with the guidance of a healthcare provider, but helping you to see that testing is not as necessary as it's often portrayed to be. And these natural agents have an impressive growing body of data supporting their use. The other thing here I wanted to make sure to share with you is our evidence-based protocol for using probiotics in the treatment of a wide variety of conditions. What we are attempting to do here is give you, across studies ranging from SIBO and IBS all the way through anxiety and depression, what is the average minimal effective dose range that's used. And for the one type of probiotic, the blends of lactobacillus and bifidobacterium, 10 billion per day for 2 to 3 months. Important update here is that higher is okay. As we've rolled out these recommendations, some people have gotten confused and asked, well, does this mean, for example, the probiotic that we use in the clinic, does this mean that the higher dose, which is 52 billion, should not be used? And that's not the case. But if we're targeting the minimal effective dose, then it's 10 billion. You can use higher, and we've used for many years a higher dose, although we're starting to shift our recommendations toward slightly lower, if for no other reason than for the cost-effective nature. And we also have Saccharomyces boulardii, the healthy fungus, 10 to 15 billion per day for 2 to 3 months, and the soil-based probiotics, 2 to 6 billion per day. These are all CFUs for 2 to 3 months. You can use one of these, or if you're looking to be extra strong, if you will, you can use together all three. You don't have to use all three. This has not yet been published other than what we're seeing anecdotally in our consulting practice, but we are hoping, hopefully, within maybe 1 or 2 years to be able to publish a study that pits one of these probiotics against 3 together and demonstrate scientifically what we're seeing, at least anecdotally, in those that we work with. Okay, so let's recap some of the points from SIBO and IBS treatments. The SIBO breath tests do not correlate with symptoms. Rifaximin improves gut symptoms in IBS, and herbal antimicrobials or probiotics are both effective for SIBO and for IBS. So again, great news. Collectively, how I interpret this is less testing and more freedom in terms of being able to use natural agents if you're not comfortable with antibiotics. And again, caveats always apply. Before you change anything, check in with a healthcare provider, but this is just the evidence, the data you can use in discussion with them to create a care plan that you feel most comfortable with. And so now let's turn our attention to inflammation in the intestinal tract, autoimmunity, and fungal overgrowths. To kick off, let's have a look at this schematic. And this is a representation of healthy intestinal physiology as compared to inflammatory bowel disease, where there's autoimmunity and inflammation. And from the journal which we adapted this from, Microorganisms, what they're trying to point out to you here is that when there's dysbiosis, which could include bacteria and fungus being imbalanced, you can impair your tight junctions, and this is where leaky gut occurs, and this will activate the immune system and skew the balance of your immune system. So then what follows is, well, what can we do about this therapeutically? And this is where things get exciting. In this first study, they looked to see is fungal overgrowth associated with this inflammation and autoimmunity. They compared healthy controls to those with Crohn's. This was in a population of kids. And they found higher levels of candida and lower levels of Saccharomyces. So there was a dysbiosis of the fungus in those with Crohn's. Now, one additional study here looking at is fungal overgrowth associated with more severe inflammation and autoimmunity. And they did find that there were higher levels of stool fungus in those who had more active inflammatory bowel disease. Now, part of this is chicken or the egg. We don't know, at least based upon the observational data. Does this mean that the fungus is causing the autoimmunity, or is the autoimmunity skewing the population of bacteria and fungus, therefore causing the imbalance? One of these next studies at least helps us with answering this question, asking the important sort of next question that one should logically ask: will treatment of the fungus improve the inflammatory bowel disease, the inflammation, and the autoimmunity? And so in this next study, they gave either placebo or fluconazole at 200 milligrams per day, this is being a prescription antifungal, to those with ulcerative colitis. And they found after 3 weeks, there was an improvement in symptom severity and also a reduction of the inflammatory marker calprotectin. So this is now suggesting that the fungus is causal, because when we treat the fungus, the inflammation and autoimmunity improve, which is really exciting. Now, in a similar vein here, this next study looked at, do we need testing to use antimicrobials in this population of people with intestinal inflammation and autoimmunity? And I'll just quote, administration of rifaximin in this case induced remission in 62% with moderately active Crohn's disease. So a group of people who had Crohn's were not given a SIBO breath test. They were just given rifaximin, and 62% of the individuals experienced remission. So again, one more data point from this randomized control trial in 400 Crohn's participants showing us that you don't need a SIBO breath test to use therapies. And I also wanted to share from the split test, wherein we took one person, they passed a bowel movement, put half into test kit 1 and the other half of the bowel movement into test kit 2. Look at what you see. Depending on the test you did, you either had candida or you did not, which is one of the reasons, again, I'm urging caution with how much we rely on the stool testing or the SIBO breath testing to dictate our care, our selection of therapies. Now, one of the things that we've discussed is leaky gut, and how when there is this inflammation and autoimmunity as seen in inflammatory bowel disease, Crohn's, and ulcerative colitis, there might be increased leaky gut. So this next study examined, is leaky gut different in those with this intestinal condition of inflammatory bowel disease or not? And they found, interestingly, that both healthy controls and those with remission of their inflammatory bowel disease had the same level of zonulin. So that's actually good news, right? It tells us that the zonulin can normalize as your condition normalizes. Really important caveat here. This was serum or blood zonulin. It was not fecal or stool zonulin. And one more similar study here looking at leaky gut, this time looking at healthy controls as compared to those with active inflammatory bowel disease, symptomatic inflammatory bowel disease. And what they found was that those with inflammatory bowel disease that was active, they had symptoms, had higher zonulin, had more leaky gut. But again, one more study finding, there was no difference in stool levels between those with active symptomatic inflammatory bowel disease and healthy control. So yet one more reason why I'm warning you off of the stool zonulin testing, always to be confirmed or checked with your healthcare provider, but they may not be up to speed on this. So you may want to bring these studies to your healthcare provider and say, geez, doc, have you seen this? Because I don't think the lab companies are going to be bringing this to the doctor. So it's more so incumbent upon you. And I don't assume any nefarious intent by any of the players, but there are incentives that unfortunately do dictate how much certain information circulates and how much just collects dust and no one hears about. And I wanted to share just one more example from that comparative study of the two different stool tests assessing the same person's bowel movement. And what do you know? There's inconsistency. It's the same stool, but one lab company, test 1, shows normal zonulin stool, and the other company, test 2, shows high stool zonulin. So again, why I'm continually trying to encourage you to be a bit more circumspect with how much testing you use. And then the final study here I wanted to cover looked at those with inflammatory bowel disease, this inflammation and autoimmunity, and if an elemental diet could improve dysbiosis and induce remission. And just a quote here, diet-induced remission was associated with a correction of dysbiosis. So in these people who were given a daily regimen of get half your calories from the elemental diet and half your calories from normal food, what they found was induction of remission, and that was associated with improvements in dysbiosis. So again, great news that a simple intervention, elemental dieting, only used in a half and half application, as we've discussed so many times on the podcast before, doesn't have to be this arduous 2 or 3 weeks exclusively. It can be used in a relaxed, what we call, and some of the researchers have described, hybrid application. Right? Wake up in the morning, have an elemental shake. Maybe have a light lunch, have a shake late afternoon, and have a dinner, right? Half and half, totally doable, absolutely livable, and gives us pretty great results. In a recap of all these studies, one more time, SIBO doesn't correlate, at least according to these studies, with GI symptoms. And you don't need to worry about if you've eradicated SIBO or not, or even if you had SIBO at baseline. The treatments like rifaximin work irrespective. And thankfully, probiotics and herbal antimicrobials have growing evidence showing that they're effective. And then remember, with inflammatory bowel disease and that inflammation and autoimmunity, there's an association to fungus. But thankfully, you can use simple tools like the elemental diet to induce remission and improve dysbiosis. And again, all of this zooming way out, hopefully to help you see there are lots of options for improving your gut health, for improving leaky gut, for improving IBS, for improving SIBO, for improving IBD. Namely, probiotics, antimicrobials, and elemental dieting, which are mainstays of the tools that we use, and just fantastic to see how much evidence is being published to help you feel confident that if you don't want to go the pharmaceutical route, you have evidence-guided recommendations for natural therapeutics. And let me also say, I have nothing against something like rifaximin, but to have, I think, the ability to participate in informed consent, you need to be aware of all the options. And that's what we're trying to do here, is make you aware of the tools that are within your reach to help you improve your gut health and hopefully see improvements in other things, like I've said so many times, joint pain, fatigue, insomnia, mood, because there is such a connection between the gut and these other systems of the body. All right, guys, this is Dr. Ruscio. I hope this helps you improve your gut health with minimal or no testing, minimal cost, and get there as quickly as you possibly can so that you're healthy, vital, and well. Alrighty, talk to you next time.